Cleveland's Police and Crime Commissioner Barry Coppinger has written a letter to the Home Secretary, Sajid Javid, outlining plans to give addicts free heroin under a scheme to allow them to inject the drug up to 3 times a day. The project, costing £12,000 a year per patient, aims to save money by improving health and cutting crime, seeking to cure addicts by giving them access to medical treatment and specialists. The West Midlands, Durham and Avon and Somerset Police and Crime Commissioners have backed the initiative. Now, whether or not you believe that Boris Johnson actually stuffed icing sugar up his nose, or care if Rory Stewart admitted to smoking opium in Iran, or indeed whether you think Michael Gove's campaign took a nosedive after he admitted to taking cocaine up his nose. Our hypocritical approach to drugs is finally beginning to change. It's about time that we all came down off the collective high caused by our 1980s war on drugs hysteria and accepted criminalising drug users just doesn't work.
So I find this a very, very interesting topic. And for me, it's not necessarily about the drugs. It's not hard versus soft. It's not about, legal versus illegal. It's about a person's relationship with a drug. So, many people will have taken drugs. And, that's their choice. It's certainly not my choice. It's not how I live my life. But for me, it becomes a problem when somebody is addicted to a drug. And that, for me, where it becomes a health issue. And it's the addiction which is causing the problems in society. And it is the addiction around which there is a huge amount of stigma. And decriminalising drugs is only one part of solving a problem. In addition to decriminalisation, you've got to be able to have proper conversations around problem drug use and addiction. And where we've gone in our society is we've got so many charities that help addicts, and we seem to be pushing the problem of addiction over to charities as opposed to actually having proper health-based strategies around how do we deal with problem drug users. And when you think of a heroin user, for example, there's so much stigma around what a heroin user is, whether it's a smackhead or a druggie or whatever it is. And actually, they are just people like you and I who've more often than not had challenges in their life, haven't been able to cope with those challenges, used a drug as a safety net, and then found themselves in a situation where they are now addicted and cannot get off that chemical. So decriminalisation, one aspect, but make sure if you're going to do that, you're going to have these drug clinics or whatever you want to call them in the streets where people can inject safely, you must then also have a joined-up effect where you've got all of the services, psychotherapy and all the rest of it to help people get off and stay off drugs in the first place.
Nick, did you realise they've never had a single death in any of these centres where they are implemented in Europe?
No, I didn't, and I find that very interesting. And I'm going to deploy the old politician's trick of asking questions and answering them. Have we lost the war against drugs? Yes, we absolutely have. Do we need to try and pioneer a new method? Yes, we possibly do. My problem with this is the poor souls who are addicted, they have to show that they are starting to wean themselves off, because there will be people watching this show right now who've got elderly relatives. The idea, £12,000. Hold on, £12,000 a year going to these people who are terrible. I know they're addicted.
It's not a zero-sum game.
They have
we
to
can fund lots of things at the same time.
They have to show that they are at least trying to come off. It cannot just be.
Can I just tell you that's less money than it costs us at the moment, because just the cost of one shared needle infecting one with HIV is up to 80,000 roughly.
I'm telling you, people watching this.
In 2017, 75 such cases occurred.
I'd tell you, people watching this would find it strange that that person, man or woman, qualifies for 12 grand when Grandad can't even get his gas bill.
So I think one of the reasons that this is such a good idea is actually, I completely agree with you, Michelle, it's that change of focus. So you shift from your approach to drugs being a war on drugs, which you're right, we are losing.
We've lost.
So it becomes, you take it out of law and order and into public health. Because what we need to do is focus on harm reduction, and that means looking at addiction. And the model that people always cite in these examples in this situation is Portugal, because Portugal did precisely that. It shifted the policy and it turned it into a public health policy. And so over the past 15 years, since that's been implemented, it's had these amazing results.
They decriminalised all drugs in Portugal.
Decriminalised all drugs. So it has gone from 100,000 people who are addicted to heroin down to 25 5,000 people. And it's also reduced the rate of infection, because obviously the risk of HIV is higher for heroin users who are often sharing needles. So creating that shift in consciousness where you try and look at harm reduction rather than crime and punishment is what has led to this transformation.
Also, drug-fueled crime, just on the money-saving aspect again, Nick. When you're clucking, when you're basically addicted and you need your next hit, and you're desperate and you don't have a health facility to utilise, that's when people are robbing people or stealing bikes, just for that 50 quid so they can buy a small dose. And the problem, of course, is the overdoses occur in that way as well, because it's an infrequent usage with impure substances, and because the purity of it fluctuates, you're injecting a consistent amount, but sometimes it's ultra pure, sometimes it's very weak, and you don't know what you're injecting and you accidentally overdose yourself. So all of these are costs on the health system, whether it's because of the overdoses or the crime cost on the criminal justice system. And what they have found whenever they've trialled these systems...
Is it open-ended? I know it saves money. Is it open-ended, Maajid? Can I just keep getting 12...
well, what they found where they implement this in certain countries, and they found that frequency of use does not increase. I haven't looked at whether it decreases, but it doesn't increase,
so
which is good news.
£12,000 a year.
Well, you're saving money. Trevor?
Yeah, I don't really know anything very much about this area, and I'm interested in listening to the argument. My contact, to be honest, is that my mother and my aunt, when they were alive, lived together, and we had to move them from the place where they live because dealers were operating outside their front door. And they're at that point, they're two 70-year-old ladies coming in and out through the needles and this and that and the other. So my instinct is actually, I would stop all of that. And this proposition is quite attractive. The problem is the place where it's been tried here in Bristol, it doesn't appear particularly to have worked very effectively. And I think there is a slight feeling of sticking plaster over a massive, ghastly catastrophe with this sort of solution. The war on drugs doesn't seem to have worked, but that doesn't mean that we do anything else that might look like it's worked. I'm not sure that I think this will solve the big problem in the United States.
Should we hear from the police commissioner? Let's have a look at what he said. He says that's the Cleveland Police and Crime Commissioner Barry Coppinger. He says the cohorts selected are those for whom all previous treatment has failed. They are the most prolific offenders. They lead chaotic lifestyles in which virtually every minute is focused on funding their next hit. And that's the clucking thing I was talking about. If we can remove that obsession, we can then look to engage other agencies, including health and housing, to finally get these users off the streets and back into society. So, but the point you made, it's interesting that the Home Secretary was requested by the Scottish representatives of the SNP in Parliament, because that's where some of these trials are being rolled out to a degree of success. And he was asked whether he could change the law to facilitate the specific rooms where people could go and inject their own substances under supervision. And he refused, citing exactly the reason, Trevor, that you've just cited, but for the opposite side. He said he grew up on a street in Bristol that was the drug dealing street, and he saw the effects and didn't like it. But actually, the rebuttal to that is what you said. You would take the drug dealers off the streets.
Well, I'm not even sure but the problem is, what I think is my uneasiness about this is I think it underestimates both the skill, the determination and the sheer ruthlessness of people in the drugs trade. They will breeze past this and they will find other ways of hooking people. And I mean, they deal at school dates. They deal at school dates.
Yeah, but this is the argument for decriminalising it and pulling the rug from their feet in terms of the black market that's inflating.
Let's hear from Michelle, then I'm going to tell you what the Home Office is saying.
I want to correct you because I've got a really uncomfortable feeling in my tummy and I feel like I need to respond because I know people that have died from heroin overdoses. I know when I was a teenage girl, I've never used heroin, just for the record, but I was unfortunately exposed to it a fair amount in my teenage years. And I know people that used to use heroin, and I know people that were desperate to get off it. And I know one particular girl, and this is what's making my tummy go funny, because when you say about grandmas and granddads and they think this, these people that use heroin, they started off the same as you and I. They're not bad people. They are people that have struggled in life, and we can argue wrongly, have turned to a drug that they perhaps shouldn't have, and then they're stuck, they cannot get off it. And these rooms that you're talking about, they're not going to work on their own. You can't have a room to allow you to inject and then arrest you in the street for carrying it when you leave. You've got to have a full 360 approach where you're doing the whole thing to support people to get off and stay off, crucially, stay off those drugs.
Here's what the Home Office says. We must prevent drug use in our communities and support people dependent on drugs through a treatment and recovery. Heroin-assisted treatment is an option open to local areas under the existing legal framework, and we support areas that pursue this approach where the relevant licences are obtained from the Home Office. Picking up on Trevor's point, Maajid, I guess it probably needs further trials, doesn't it?
9 EU countries and Canada and Australia are trying it, and it's all seemingly successful.